So transitioning is a deeply personal, individual decision someone can make. It's not my role to tell people how, when, or where to transition. I want to help them come and make decisions about that themselves. And so in initial therapy, usually what I'm doing is trying to get a better understanding of how the client sees their own gender identity, um, what's important to them, about transitioning, and what does that look like going forward to them. A lot of times there can be a lot of stigma, shame around being transgender, a lot of fear of rejection. And I want to create the space to explore and accept their gender identity, feelings around their gender identity, in a safe and supportive environment. Ultimately, getting less hooked on, less entangled in self-criticism, and or less entangled in societal expectations. So one of the ways that I set the stage with clients is the ACT choice point. And the way I explain it to clients is, it's easy for therapists to fall into this trap of, hey, how are you doing? How was last week? Let's talk about your pet again. Okay, session's up. See you next week, same time, and lose track of longer term goals. I like to provide clients a roadmap, but what are we actually trying to do in therapy? And what we're trying to do in therapy from an ACT consistent model. So one of the tools I use is called the ACT choice point. Start out by asking them, can I draw you something? It's kind of a map to help keep us on track with what we do. Start out by giving them a definition of behavior. All day long, humans do things, cook, drink tea, watch movies, sleep, think. If it occurs within 24 hours, we can do it externally, or we can think about it. It's a behavior. Thinking, rumination, worrying, everything is a behavior. And now there's certain things that we do. Draw a map, draw an arrow. Certain things that we do that bring us closer to the person we want to be, bring us closer to the things we care about. Using non-technical, non-jargony language, tend to call those, towards moves. Something that just brings you in the direction of your values, brings you towards what you care about. And then some things we do, they bring us further away from person we want to be, from things we care about. Context matters a lot. Sometimes, one behavior is a towards move in one context and an away move in another. And drinking wine with friends or a romantic partner, at a dinner, that's good because the wine tastes good, or, there's that intimacy and connection with the people around you. On the other hand, drinking a whole bottle of wine at night in the dark by yourself, maybe that's a little bit more of an away move. Maybe it's contradictory to your health values. The problem is, when life is going difficult, it's so much harder for us to choose to be patient, to be kind, to be our best selves, to be our authentic selves. And most of the time, life is difficult. Financial stress, health problems, relationships concerns, little sleep, pain, all these things can make it so much harder for us to choose a towards move and make it so much easier for us to choose an away move, to ruminate, to isolate, to not be the person we want to be. And in this activity, I ask them to identify a couple people who are important to them. A couple of notes about this. This is meant to be illustrative, not comprehensive, just to set the stage and give a roadmap. And so for Ava, she mentioned Dan, Micah, Grayson are important people to her. And I next asked them, what would it look like if your life is a silent film? It's a documentary. People could only see your behavior. What would they see that would make them think these people are important to you? And they'll say things like spending time with them, sharing important aspects of their life. I also try to get a sense of what do you want to pursue in life? What's important to you? What are these bigger, broader values you have? And for Ava, that was kindness, understanding, curiosity, openness, authenticity came up. I then jumped to the other side of the map and Ask them, when difficult thoughts, feelings come up for you, what are things that you do that bring you away from who you want to be? And for her, she mentioned ruminating, isolating herself. Sometimes she'll be terse, short, irritable. And we walk through, what's the payoff? Like, what's the benefit of those away moves? People might do, harmful drugs because there's a sense of euphoria. We do things because we get something out of it. And ruminating, isolating, being terse, she noted, it takes much less energy. You don't have to regulate your emotions. It's just easier. The downside, the cost of those things are, maybe you beat yourself up. It's incongruent with your values. You distance or push people away.